Hey guys, thanks for anyone that watches this video. My name is Josh Cochran. I am 22 years old. I am a student at University of Houston studying my bachelor's in human and foods nutrition, and this is my presentation for Kinesiology 3305 on blood doping in sports. So what is blood doping? Blood doping is the practice of boosting the number of red blood cells in the bloodstream in order to enhance athletic performance. Because such blood cells carry oxygen from the lungs to the muscles, a higher concentration in the blood can improve an athlete's endurance and aerobic capacity. And aerobic capacity is also known as VO2 max, which is the maximum rate of oxygen consumption measured during incremental exercise. That is exercise of increasing intensity. So there's different types of blood doping. There's blood transfusions, injections of an erythropoietin, and injections of synthetic oxygen carriers. Blood transfusions. In normal medical practice, patients may undergo blood transfusions to replace blood lost due to injury. Transfusions also are given to patients who suffer from low red blood cell counts caused by anemia, kidney failure, and other conditions or treatments. Illicit blood transfusions are used by athletes to boost their performance. So for blood transfusions, there's two main types. There's an autologous transfusion and a homologous transfusion. The autologous involves a transfusion of which an athlete's own blood, which is drawn for them and stored for future use. The homologous transfusion is the transfusion where athletes use the blood of someone else with the same blood type, so they're getting blood donated to them. EPO injections. EPO, which is the second type of blood doping, is a hormone produced by the kidney. It regulates the body's production of red blood cells. In medical practice, EPO injections are given to stimulate the production of red blood cells. For example, a synthetic EPO can be used to treat patients with anemia related to chronic or end-stage kidney disease. Athletes using EPO do so to encourage their bodies to produce a higher than normal amount of red blood cell to enhance their performance. The third and final type of blood doping is synthetic oxygen carriers. These are chemicals that have the ability to carry oxygen. Two examples are HbOCs, or hemoglobin-based oxygen carriers, and PFCs, perfluorocarbons. Synthetic oxygen carriers have a legitimate medical use as emergency therapy. It is used when a patient needs a blood transfusion when there is not enough time to find a proper match of blood type, human blood's not available, or there is a higher risk for blood infection. I know that can be kind of confusing, but this is a quick little visualization of how hemoglobin will transport the oxygen. So the oxygen comes into your lungs, and in the capillaries where the red blood cells are, the hemoglobin inside of the red blood cell will attach to the oxygen. Then the red blood cell travels through the body, and as it reaches the muscles, the hemoglobin will be transported from the red blood cell to the muscle. And as the red blood cell comes back through the system, it will release carbon dioxide in the lungs. So some side effects of blood doping. Increased blood viscosity, which is the thickness of the blood. It can cause heart attack, strokes, infections, the risk of hepatitis C, B, and HIV, fever, hypertension, vasoconstriction of the vesicles, impaired oxygen delivery to tissues, which is the reverse effect of what blood doping is looking for, kidney damage, chest pains, fever, headaches, increased blood pressure, shortness of breath, swelling of the face, fingers, and weight gain. Effects on performance. So how does blood doping affect the body, and how does it increase performance? Blood doping is most commonly used by endurance athletes, such as a distance runner or cyclist. By increasing the number of red blood cells within the body, it increases the hematocrit. The hematocrit is the ratio of volume of red blood cells to the total volume of blood. Higher volumes of the protein hemoglobin are present because of this. Hemoglobin binds to and carries oxygen from the lungs to the muscles, where it can be used for aerobic respiration. Blood doping therefore allows extra oxygen to be transported to the working muscles, resulting in a higher level of performance without the use of anaerobic energy systems. Studies have shown that blood doping will improve the performance of an endurance athlete. So how common is blood doping? The USADA, or the United States Anti-Drug Association, states that Lance Armstrong used EPO blood transfusions, testosterone, and cortisone during the period from 1998 through 2005, and that he had previously used EPO, testosterone, and human growth hormone through 1996. This is just one big name, but there are several names in the industry, the sports industry, that have been found out blood doping, and I'm sure there's many more that have never been found. Some more big names found are Maria Sharapova. This was a Russian that played tennis in America. She was the #1 Russian player for 5 years. Then she got found out as a blood doper, and she now cannot play tennis anymore. It begs the question of if she was the best tennis player in those 5 years. There was Tyson Gay. Tyson Gay was a 100-meter sprinter that was to rival Usain Bolt. Usain Bolt is the world's fastest man currently, but Tyson Gay was not even allowed to race in the Olympics because of this blood doping incident. Diego Maradona. Diego Maradona was the World Cup goalie in 1994. He was actually in mid-game whenever he was taken out because of blood doping. Anderson Silva. Anderson Silva was a UFC middleweight champion for 10 straight titles. So he won the title as a middleweight champion, and he was able to defend it 10 times in a row. This begs the question of all these players and many more, are they the best? Were they actually as good as they were because of who they are and how they're training, or was it because of blood doping enhancements? In a study done in 2011, SOTAS PE in a random testing of 7,289 elite athletes averaged that 14% of all elite athletes were blood doping. This is a quick video visualization of blood doping effects.
The drug erythropoietin has been widely used by professional cyclists. The substance was part of Lance Armstrong's doping regimen.
So they talk about Lance Armstrong first.
Falls from grace in sports history, causing him to lose his 7 Tour de France titles and an Olympic.
So he lost 8 titles because of his blood doping use.
Which is more commonly known as EPO, is the most detected banned substance among athletes in the doping category.
Of those 3 blood types, EPO is the most used.
The hormone that's naturally produced by the kidney. It stimulates cells in bone marrow to make new red blood cells.
EPO is produced by the kidneys, as she just said. That's why the examples in the medical were kidney failures. This is why EPO is synthetically induced with kidney failure,
which carry oxygen to muscles throughout the body. Medically, it is used to treat patients with chronic kidney disease or renal failure because they can't produce enough erythropoietin to make these oxygen carriers. The peptide is also given to cancer patients in cases where chemotherapy makes them anemic and unable to produce enough red blood cells. Athletes inject it to boost their body's production of these cells. More blood cells mean muscles get more oxygen, which lets them work harder and longer, giving them a boost in performance.
This is where the aerobic comes in because they get to avoid the anaerobic energy expenditures because of how much oxygen they have in their muscles.
This practice is known as blood doping. EPO has been banned in sports since the early 1990s, but tests to screen for it were first used in the 2000 Summer Olympics in Sydney.
So they didn't start screening for it until 10 years after the banning.
To thicken so much that there's an increased risk for developing blood clots.
This is one of those red risk factors, the blood viscosity thickening. If one of those blood clots were to get large enough and to break free and get into the heart or the brain, it could be fatal.
And beyond the physical side effects, it's done untold damage to the sports world.
So this is a graph of the flunked blood doping after they started screening. In 2003, it found out that there was about 2,400 athletes that were blood doping. And of those 2,400, you can see that the orange are the Olympic sports or the Olympic athletes, and the blue are the non-Olympic athletes. So the flunk rate had been increasing from 2003 till 2007, where it reached about 4,200 or 4,200 athletes. It had a big drop off in 2008, but it has steadily increased to even today. So the war on doping. Prior to the 1980s, before the ban on EPO, anti-doping policies existed to discourage athletes from dropping dead from overdose, which was actually very common in performance sports like cycling and running. The war on doping is now being waged by the WADA and the USADA is that the essential purity and goodness of sports has been dirtied by dopers. From a socio-cultural standpoint, they want to preserve the idea of having integrity and character for both athletes and audience. This goodness and purity relates directly to the integrity and character. A lot of these big name athletes, and even not the big names, but just athletes in general, are role models for their audience. So whenever they get found out as essentially cheating or breaking the policies, it really puts a bad name on the sport and themselves. So blood doping is the practice of boosting red blood cells in the bloodstream to increase performance. This practice consists of blood transfusions, injections of EPO or erythropoietins, injections of synthetic oxygen carriers. This will bring more oxygen to active muscles, improving performance. Blood doping can have serious side effects from heart problems, infections, physical swelling, and weight gain, and many of these risk factors can be fatal if not treated. An average of 14% of all elite athletes are blood doping. Blood doping is currently being combated in sports to protect the health, purity, and goodness of sport for players and the audience. Thank you.